Welcome back to the Your Health television program hosted by the Monterey County Health Department. I'm Emily Sciolto, your host today and just about every third Monday of each month. I'd like to continue our discussion on youth violence prevention by welcoming my next guest, Ms. Linda McGlone. Linda is the STRYVE project coordinator at the Monterey County Health Department. Welcome, Linda, and thanks again for talking with me today.
Thanks so much, Emily, for having me.
My pleasure. So, Linda, what is STRYVE, and what does STRYVE stand for?
STRYVE stands for Striving to Reduce Youth Violence Everywhere.
Okay, great. And what does that mean? What does that mean to me, to us?
You'll hear youth violence in there. There's a strict focus on preventing youth violence. The everywhere is really just 4 cities in the country. 4 public health departments received the grants, and that would be Boston, Portland, Oregon, Houston, and little old Salinas.
Wow. So just to make sure I'm on the same page, the CDC, Centers for Disease Control and Prevention, awarded 4 grants nationwide, very competitive, and we were one of them, Salinas, California?
We were one of them, and when you write a grant like this, it's very sad in that you look at the statistics and you realize the problems that Dr. Stallworth pointed out, the number of homicides that we've had, the percent that are gang-related, the percent that are where a gun was the weapon. So we unfortunately were able to demonstrate that we had a very significant problem.
So I'll be reminded to not get too excited about this. I was getting all excited about us getting something. We'll get into that more a little bit later. But I guess I want to ask you, why does this initiative encourage the leadership of local public health departments in preventing youth violence?
Public health departments bring an expertise and a process to the epidemics, to the problems that they address. We are data-driven. We want to know what the problems are, how significant they are, who is a target group. So we're very analytical and scientific in our approach, which is not to say that there's not a lot of programs that really come from the heart, where you have a board that really feels good. And that is a real resource, but what we want to do is help them measure how effective these programs are. The other thing about public health is we focus on prevention, and we're good at prevention. We are also, I said we're data-driven, prevention, and when you look at this problem, it's truly a public health crisis. And it's a problem that falls into our domain, if you will, for a couple reasons. One is the health costs for treating the victims of the shooting, for airlifting kids to San Jose. These are very expensive. The kids who end up being quadriplegics because they've been shot in the spine, those are lifetime costs that are extraordinarily expensive. And so we're interested in those costs and the societal costs. The young men, and it is young men, and they are young, that are dying in this epidemic are in the peak of their life. When they die, we consider years of life loss. We think about years of lost productivity. So this is not the very old, and it's not infants. It's young men in their prime being able to give back to their community. So those are a few of the reasons that we've taken an interest in this.
I see, and they do, I think, fall under the public health domain, and there's the cost in all aspects is very high. That's an interesting way to quantify things, at least in for this type of discussion. So with this agreement, this STRYVE, from what I understand, it's STRYVE through local public health leadership cooperative agreement. It's an agreement. And what will the health department do in this agreement?
Okay. Again, we have a very methodical process. We'll begin looking at our data. As Dr. Stallworth said, we're going to look at the risk factors Risk factors are those conditions and those qualities that make an event more likely. So folks are very familiar with the risk factors for heart disease. You don't smoke, you keep your cholesterol down, and you exercise, and a few others. And if you do that, you're less likely to have a heart attack. Data has shown that over the last 30 or 40 years. Youth violence is a relatively new area in public health, and so we're still finding our way. But there's a great deal of excellent literature that quantifies, that shows what are those characteristics in a community, in an individual, that make youth violence more possible. So we're in that analysis phase right now. That's just the beginning. We've been at this for a few weeks now. The next phase then will be to implement some strategies that will address those particular risk factors. And we want to draw a line straight from a risk factor like truancy to a strategy that lowers truancy. What helps keep kids in school? How did they begin to struggle in school? Are there signs, even in the 3rd grade, that this child can't read at grade level and is already struggling? And that struggle compounds itself over time until they walk away and say, I can't do this. So we'll be looking at what strategies suit our particular set of risk factors, and then we're going to pilot test some of those strategies in the community. So what may work in Boston may or may not work here in Salinas with our differing demographics, for example. We will evaluate programs to see what works. If it doesn't work, then we'll put it on the shelf, or maybe we revise it. But we want things that work and that are most relevant to our community. Along the way, we'll provide training, building the capacity of our health department and our partners in the community. This is a tremendous resource that we've been given, this agreement with the Centers for Disease Control, and brings phenomenal information and contacts and training with Centers for Disease Control and Prevention. There'll be training that's ongoing, and then also we want to make sure that what we do finds a home in the community and thrives in that home. So for example, if we found programs that are particularly good for after-school programs that prevent youth violence. So again, we want to draw that line very specifically. What are after-school programs doing that they think will influence youth violence? And we'll use the best practices, things based on evidence, and those programs don't need to be expensive. We'll buy materials on that and train the staff, and then once the staff is trained, we hope that capacity will live on in that after-school program. So sustainability is really important, and folks I know get frustrated when especially federal money comes and federal money goes. And then what's left? Well, we want to make sure that capacity has been enhanced, that a program can live comfortably in a particular agency and can go on. And we want to help those agencies find any additional funding that they might need to go forward. And if you've ever written a grant application, you know that they want to know outcomes. They want to know what you can do. And we'll be able to provide agencies that participate in this with data to show we made a difference and we're a good bet to fund.
I see. That is indeed, it sounds very sustainable. Homegrown data, you know, we've got it. We've kind of honed it and you know, not crafted the data, but we've crafted our activities. We have the data, and so that's what we'll do in the co-op agreement, and that's more or less also how Salinas community partners and other stakeholders will do as well. You mentioned the health department's process at first is to kind of identify these risk factors, look at different strategies, make that connection, and then pilot test a couple of them. And so that's where the community partners and stakeholders come in, correct?
Absolutely. We can't do this on our own. And our partners that we've met through CASP, the Community Alliance for Safety and Peace, other partners in the community are the ones, in addition to what the health department can do, that will be implementing some of these programs, practices, policies in different sectors. And we want to reward those folks for stepping forward and saying, okay, we'll do something a little different. We want to make sure that what we're doing really works. It seems very elementary, but agencies don't always have the capacity to gather data, do the statistical analysis to see if change was in fact made, and then to find programs, to take the time to find programs or practices, policies. A lot of folks don't think in terms of a policy. Policies aren't necessarily expensive, but if you could, for example, duplicate what Salinas City Elementary School District does, which is to identify kids in the 3rd grade, as I mentioned, by their grades, by their attendance, and by their behavior, and then flag those kids for additional assistance, that's a policy, that's a practice that they've put in place in their schools that will help those kids. So there's an array of things that can be done. There'll be training that will be available to our partners, as I mentioned. We want to help them sustain what they do, and we feel we'll have a much richer solution if we can get a lot of our partners in the community, city agencies, county agencies, nonprofits, enthused about this.
It's going well so far, at least for me.
Would you like to join us?
My smile gets bigger as we keep talking about this. So, okay. So what are some examples of these strategies that might work in Salinas? We've talked about matching the strategy with the risk factor. Can you talk a little about the strategies?
Sure. There's a chain of events. There's about 12 or 13 things that we're looking at, and there's a couple that are sort of a constellation of risk factors that are fascinating. If you talk to the people who provide mental health services to the young people that are incarcerated or in the probation system, one of the things that they'll tell you is these kids have come from very violent homes. Not all of them, but many. Have seen a lot of violence in their home, and they've also seen violence on the streets. The number of shootings that we've had, the number of homicides. As an aside, I was sitting next to someone and they said, "Oh, have you seen this?" And they showed me a picture on their phone that was being sent around by texting that was a homicide victim lying on the ground bleeding. And the kids all had pictures of it, and they were sharing that picture and making comments underneath, some of them critical and others congratulatory. So our kids have seen a lot of violence in the home, in the neighborhoods. When they get in a school setting, the people that they've seen perpetrate this violence are men, more typically than women. The boys identify with that male violence, and they begin to bully someone at school. They repeat what they've seen in the home. Kids that are bullied are more likely to join a gang, bully someone else. And so if you look at that whole chain of events, you can look at the individual child and say, okay, so what are some strategies for anger management? What are some strategies? What do you do if you're bullied? What do you do if you feel like bullying someone? If you feel like you want to go on their cyberbullying and go on their Facebook page and begin problems? Then there's clearly some areas within the home that need to be looked at that trigger this whole chain of events. And then what about within the community? If we can bring the shootings down, if we can bring the homicides down, that's a much better environment for a child to grow up in. The violent video games. I saw some kids on a computer on the internet, and they were watching the beheading of the Mexican drug cartels over and over on YouTube. What does that do to a kid? So you can see there's constellations of risk factors, there's a variety of things to work on, and we're looking forward to working with CDC to find those strategies that are the best fit for us.
That's amazing, and that really is the key, is the fit.
Yeah,
you know, it's
absolutely.
The strategy has to match the behavior, and the program has to match the agency in order for it to be sustainable. And that's just, you know, amazing what that translates to. You know, what experience youth are having these days, young men, and what that's translating into. I see why this is a huge problem, and why, you know, we've definitely got a lot of resources behind our back now, though, to help us deal with this and to make it a better community all around.
Absolutely, yeah.
So thank you again, Linda, for taking the time to be with us today, and congratulations on this, you know, accomplishment of bringing these resources to our area. That's amazing that you've been able to do that with help of others. Indeed. I
had a lot of help. You were a help. And we have a number of really excellent grant writers at the health department. And you've got to be awfully good to compete on that level, and no individual does it by themselves.
There's a good team. Good team.
Good team.
So if you'd like anything, if you'd like more information on anything you just heard about the STRYVE project, please visit the Monterey County Health Department website at www.mtyhd.org. Again, that's www.mtyhd.org. Right now, we're going to take a short break.